Hi, welcome to today's live on the topic Who can benefit from ImmuLIT treatment? I am Dr. Mohan Rao. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai and in many other places in India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using our patented process of lymphocyte immunization therapy, also known as ImmuLIT, and other immunomodulatory treatments. So now let's come to today's topic, and that is who can benefit from ImmuLIT treatment. Many times we get inquiries or calls from our patients asking us about our treatment of ImmuLIT and whether it will be beneficial for them. To clear this query, I am going to discuss today who can benefit from ImmuLIT treatment. Now, ImmuLIT is a type of lymphocyte immunization therapy. It involves a patented process which is branded as ImmuLIT, and it is an active immunomodulatory treatment which is useful for couples with so-called unexplained reproductive failures where the underlying cause can be immunological rejection of pregnancy. Now, the success of this ImmuLIT treatment depends on proper selection of couples for the treatment. And this selection depends on two important factors. The first one is the clinical indication, and second is the immunological investigations. So let us see first the clinical conditions in which ImmuLIT can be beneficial. The first condition is repeated miscarriages. Almost 2 to 5% couples face this problem of repeated miscarriages. In almost 50% of these couples, the exact cause of repeated miscarriages cannot be found out. In such cases, the chances of alloimmune factor as the underlying cause is highly likely. As the number of miscarriages increase, there are more chances of alloimmune abnormality. And therefore, in these cases, ImmuLIT will be beneficial. The second clinical condition is recurrent implantation failures or IVF failures. Almost 10% of couples who undergo IVF treatment face the problem of recurrent implantation failures. And in a significant number of these couples, the underlying cause cannot be found out, and they are likely to be due to alloimmune rejection of pregnancy. So, ImmuLIT will be beneficial for these couples. The third category is patients who have unexplained infertility. Now, here all known factors that are responsible for infertility are normal. Basic fertility treatment, including IUI, has also failed. And in these couples, ImmuLIT can be beneficial even before doing the next IVF treatment. The fourth group, clinical group, is certain type of unexplained late pregnancy losses, especially with early onset severe preeclampsia. In such cases, alloimmune problem may be there, and ImmuLIT can be beneficial in these cases. Although these clinical groups which I just mentioned, the ImmuLIT treatment can be beneficial, but the correct selection of couples with these problems depends on the immunological test reports, and they are the most important. The immunological tests that are useful to select couples who will be benefited by the ImmuLIT treatment are lymphocyte cross-match, peripheral blood natural killer cells, uterine natural killer cells or CD57 cells, serum TNF-alpha, and antithyroid antibodies. The lymphocyte cross-match, it helps to detect anti-paternal antibodies or blocking antibodies. These antibodies help to protect pregnancy. A negative cross-match indicates that ImmuLIT will be beneficial. It is a simple test that is done with the husband and wife's blood together. The second test is peripheral blood NK cells. Increased Th1 type of cells and many times low CD1656 cells indicate that ImmuLIT treatment will be beneficial. The third test is serum TNF-alpha. TNF-alpha is an inflammatory cytokine, and raised levels of TNF-alpha are detrimental to pregnancy, leading to a miscarriage or IVF failure. So, patients with raised TNF alpha are benefited by ImmuLIT treatment. The fourth test is estimation of antithyroid antibodies, the anti-TPO and the anti-thyroglobulin antibodies. Now, raised levels of these antibodies can have adverse effect on pregnancy. And ImmuLIT is beneficial in these cases as the blocking antibodies generated by the ImmuLIT treatment competitively inhibit antithyroid antibodies for their impact on pregnancy. ImmuLIT is followed by use of immunomodulatory medications in these cases. Lastly, endometrial NK cells or estimation of CD57 cells in the endometrium is also helpful to select couples who will be benefited by the ImmuLIT treatment. CD57 cells are embryotoxic and are not present normally in endometrium. They are found by maturation of CD56 cells if their concentration in endometrium is very high. The estimation of CD57 cells in the endometrium is done by doing an endometrial biopsy in the luteal phase. The endometrium is sent for immunohistochemistry for CD57 positive cells, and presence of CD57 in endometrium indicates alloimmune problem, and these cases will be benefited by ImmuLIT treatment. Now, sometimes certain tests are recommended related to the immunogenetics. The first one is HLA allele sharing. Now, this test is interpreted as if there is sharing of HLA, especially HLA-DQ, then there is more chance of a miscarriage or IVF failure. However, this is just a predictive test and can't tell whether protective antibodies will be there or not. The other test that is recommended is KIR genotype and HLA-C. Now, this test indicates that if KIR genotype is AA, there is more chance of reproductive failures. In addition, if the HLA-C shows C2 allele, especially in the father, then there is more chance of reproductive failure. However, again, these tests are predictive. The outcome of KIR-HLA-C interaction is influenced by other important factors like HLA-G and HLA-E, which are not tested. So, these immunogenetic tests, which are expensive, have only predictive value and are not recommended by many clinical reproductive immunologists in many countries, including the United States. Even in presence of adverse immunogenetic predictions, sometimes to the extent of the couple is told that they will never conceive or will always miscarry, immunomodulation can be beneficial in such cases. So, in conclusion, the clinical conditions where ImmuLIT will be beneficial are unexplained repeated miscarriages, unexplained recurrent IVF failures or implantation failures, unexplained infertility, and unexplained late pregnancy losses. The immunological investigation reports of negative lymphocyte crossmatch, then the raised levels of certain levels of peripheral NK blood cells, raised TNF alpha, raised antithyroid antibodies, and presence of CD57 cells in the endometrium indicate that ImmuLIT treatment will be beneficial. Finally, the success of ImmuLIT depends on proper selection of couples for the treatment, and if we follow these clinical and laboratory criteria, we can use ImmuLIT treatment effectively with excellent success rate.